Well, Social Security is not part of the fiscal cliff and not part of the deficit problem. Social Security has some medium-term problems. You don't fix those by raising the retirement age, even though people that dress like I do can, often work till they're 70. People that work at a diner, people that work manufacturing or construction, many people that work at a desk, behind a desk for years, can't work until they're 70. It's just the body doesn't physically allow that. And I will not agree to raising the retirement age to do something like that. Also, I'm concerned about benefit cuts. Half of Ohioans rely on Social Security for more than half their retirement. So I would tread very cautiously there. We can talk about raising the cap. There are things we can do in Social Security that don't damage the beneficiaries. And I think it's important to remember in Medicare, people talk about, my opponent wants to voucherize Medicare and turn it over to the insurance companies. I don't call Medicare an entitlement like some do. To me, Medicare is an investment that people pay into it their entire working lives, and they expect a defined pension benefit when they retire, and so we have that obligation. There are significant ways to save money. We've enhanced the Medicare drug benefit. Seniors have saved over 100,000, over 200,000 seniors under the Obama health care plan have saved money on saved an average of $600 on their Medicare prescriptions because of the Obama health care law. Over 1 million seniors in Ohio have gotten free checkups with no copay or deductible because of the Medicare law. So this $700 billion cut that some conservatives like to say there is doesn't really exist in terms of a cut. Medicare benefits have gotten greater, not less. So we save Medicare. We save money in Medicare in terms of giving hospitals incentives to keep people out of the hospital after those first crucial 30 days after discharge, helping them with compliance on their drug regimen, on physical therapy, on doctor visits, on nutrition. We save money on Medicare by negotiating drug prices directly with the drug company. We can save money on Medicare by allowing reimportation to get less expensive drugs. There's a whole host of ways that are legitimate, that will not undercut the universal nature of Medicare, not undercut it being an insurance, not a non-guaranteed benefit. I emphasize that one of the real contrasts in this race is my opponent wants to voucherize Medicare and turn it to insurance companies. I think people that pay into Medicare expect a defined, guaranteed benefit. And Social Security and Medicare, with me, that's what they'll get. I'll never agree to turn Social Security over to Wall Street. I'll never agree to turn Medicare over to insurance companies.